Situated on Bidjigal land, the Coast Hospital was established in 1881 as a specialist infectious diseases hospital. Renamed Prince Henry Hospital in 1934, it gained an international reputation for research into and treatment of debilitating diseases such as leprosy, smallpox, polio and HIV, amongst others. After more than a century of operation, the hospital closed in 2002 and the 53-hectare site was sold to Lancome, a major property developer. As part of the development deal, one of the historic flowers boards was donated to the community as a nursing and medical museum, to be run by a committee of Prince Henry Hospital trained nurses and former nurses. This committee became the Prince Henry Hospital Trained Nurses Association. My name is Adrienne Pearson. I am currently the Secretary of the Prince Henry Hospital Trained Nurses Association. Our aim is to present and display the history and achievements of the hospital, the medical and the nursing staff, and to tell the stories of the public health system of New South Wales. Aside from the museum, we also manage the Coast Chapel, the Nurses' War Memorial, which highlights the service of our nurses given in World War I and II and other conflicts. The museum is funded by entry fees and the tour groups that we have through the museum, but we are heavily subsidised by our chapel, where we charge fees for weddings and funerals. When I joined in 2019, the association realised that we had a unique opportunity to increase the visibility of our museum. The World Health Organization had designated 2020 to be the International Year of the Nurse and Midwife. The committee decided to create a new exhibition to celebrate the long history of the hospital and the infectious diseases we'd had here, as well as the nurse's role. And we decided to name the exhibition Bravery, Bandages and Bedpans. We decided to launch the exhibition on International Nurses Day on May the 12th, 2020. However, we all know what happened.
A giant padlock is about to snap shut on Sydney and the rest of the state as we go into an unprecedented lockdown.
So we quickly responded to launch our exhibition online with our new website. The income from the chapel and the museum was shut down, and we realised we were in a very tight predicament. We recognised an opportunity that media would be looking for clinical settings for stories about COVID, and that we had the ideal place in which to film. So we took heaps of photos of areas within the museum, the props, the machinery, and we uploaded them to Screen New South Wales with a message. If you're thinking of filming in a clinical location, all hospitals in New South Wales will be closed. This is an alternative for you to use. We were so delighted when the phone began to ring, and we were approached by companies who wanted to shoot commercials, interviews, music videos and dramas, including Huggies, who've come for a second round this year, and Who Do You Think You Are, and 10 Pound Poms. 12 months on, we are still getting referrals, and we still have film companies coming through, and we are using our chapel as a location as well, and we've revised our fee structure, which is helping the museum. The biggest advantage of the income from the filming has meant that we are no longer solely dependent on the income from the chapel. We are now able to contract a volunteer coordinator who has recruited more volunteers, not just nurses, but people from the community who bring other skills to our workforce. And recently, our committee have decided to employ someone part-time that has museum qualifications and is a professional in the field, which will assist us in our collection management and keep the doors open for at least another 120 years.